Welcome back into Everyday Kentucky. We're over here at the Turfland Mall location of UK HealthCare Sports Medicine. Dr. Austin Stone is here with us. Doctor, you do all kinds of things, but and let's talk a little bit about the knee today and talk about what is the difference between, say, an ACL and a meniscus. We hear all these different terms.
Right. So ACL injuries are really common, especially in high school athletes. They make up about half of all knee injuries in the high school athlete. So the ACL injury is the ligament that connects the two bones that is really responsible for rotation. If that gets torn, you've got to have that reconstructed. And an ACL reconstruction can take you out for approximately 9 months.
Right.
The meniscus is cartilage in the knee that helps stabilize the knee too. Those recoveries are a little bit easier if you can repair it. If you can repair the meniscus, you can probably get back in about 4 months, depending on your rehab.
And in terms of doing that, is it because high school athletes are still developing that there are so many of those injuries and the muscles around the knee and things haven't fully developed?
You know, it's mostly dependent upon sports exposure. We know that in female adolescents, it's about 1% per season in soccer and basketball about injury risk. And so, you know, if you have a tri-sport athlete, that's a lot of injury exposure, and so they're very common. In males, it's football and lacrosse, and it's about 1% per season for those people too. So it's just really about the time out on the field.
Obviously, you're involved in making sure people get rehabbed and get back out on the field. But what can they do on the front end to try and mitigate injury?
I think one of the most important thing is having good muscle strength, coordination, and balance. So a lot of those fundamental drills that they teach you, those are span sports. They're very relevant. Good hip strength, good quad strength, good core strength.
The other thing I'd say is that I don't think many people realize just how advanced not only what you do as a surgeon, but the tools you're working with. I mean, you get to guys my age and older, and they've got the old zipper on their knee and everything, and it's much less invasive and a much higher level of positive outcomes.
Yeah, I think, you know, the most important thing that I think we've learned as a community is really focusing on doing the best anatomic surgery we can, and then making sure that the rehab really addresses the underlying problems that got the patient injured in the first place.
Absolutely. Doctor, we appreciate the time. Thanks so much for what you do.
Thank you.
All right, and we'll see you next time here on Everyday Kentucky.